Coronary heart disease remains the leading cause of death worldwide. Unfortunately, many people do not realize that they have this disease until it is too late. In fact, according to heart health experts, coronary heart disease often shows certain symptoms that can be recognized early. In this article, we will discuss in full the signs of coronary heart disease according to medical experts, including classic symptoms and symptoms that are often ignored, and how to recognize them early. What is coronary heart disease? According to the American Heart Association, AHA, coronary heart disease, CHD, occurs when the main blood vessels that supply blood to the heart, coronary arteries, become narrowed or blocked due to the buildup of cholesterol plaque, atherosclerosis. This causes blood flow to the heart muscle to decrease, so that the heart does not get enough oxygen and nutrients. Signs of coronary heart disease according to experts. The following are some of the signs and symptoms of coronary heart disease that have been identified by experts from various leading medical institutions. 1. Chest pain, angina. Dr. Martha Gulati, a cardiologist from the University of Arizona, said that chest pain is the most common sign of coronary heart disease. However, the form of pain can vary. It feels like pressure, tightness, heaviness, or burning, appears during physical activity or stress, then subsides during rest. Can spread to the left arm, neck, jaw, or back. 2. Shortness of breath. According to the Mayo Clinic, shortness of breath that occurs during light activity or even at rest can be a sign that the heart is not pumping blood effectively. This shortness of breath occurs because the body lacks oxygen due to disrupted blood flow to the heart. 3. Cold sweat. Dr. Nika Goldberg, a cardiologist from NYU Langone Health, emphasized that cold sweat that appears suddenly, especially for no apparent reason, can be a sign of a heart attack in progress. This is the body's response to extreme stress due to lack of blood supply to the heart. 4. Nausea and vomiting. In some people, especially women, symptoms of coronary heart disease can appear in the form of digestive disorders such as nausea, vomiting, discomfort in the upper abdomen. According to Harvard Medical School, women experience atypical symptoms like this more often than men. 5. Extreme fatigue. Excessive fatigue for no apparent reason, especially if accompanied by other symptoms such as shortness of breath or chest pain, can be an early sign of coronary heart disease. The Cleveland Clinic states that this symptom is common in women and is often mistaken for ordinary fatigue. 6. Irregular heartbeat, arrhythmia. A pounding heart or irregular heartbeat can also be a symptom of coronary heart disease, especially if it occurs suddenly and often recurs. According to Johns Hopkins Medicine, arrhythmia can occur because the heart muscle does not receive enough oxygen due to blocked arteries. 7. Dizziness or lightheadedness. If you feel dizzy or like you are going to faint, especially accompanied by other symptoms such as chest pain or shortness of breath, this could be a sign that your heart is not pumping blood properly. Symptoms of coronary heart disease in women. Experts, including Dr. Laxmi Mehta of the American Heart Association, remind that women often experience different and more subtle symptoms than men. Here are some common symptoms in women: extreme fatigue, sleep disturbances, excessive anxiety, digestive disorders, and pain in the back or jaw. Women tend to ignore these symptoms because they are considered unrelated to the heart, symptoms that are often ignored. There are several signs of coronary heart disease that are often considered trivial, even though they are important to pay attention to. Pain like catching a cold. Mild chest pain that feels like bloating or catching a cold could be angina. Frequently waking up at night due to shortness of breath, swelling in the feet or ankles. Decreased ability to exercise, that used to be no problem. When to see a doctor? According to guidelines from the National Heart, Lung and Blood Institute, NHLBI, you should see a doctor immediately if you experience chest pain that doesn't go away within a few minutes, sudden shortness of breath, fast and irregular heartbeat, unusual fatigue. Early examinations such as EKGs, blood tests, and coronary angiography can help detect this condition early. Prevention of coronary heart disease. Experts also emphasize the importance of prevention, which includes controlling blood pressure and cholesterol, quitting smoking, adjusting a diet low in saturated fat and sugar, exercising regularly, maintaining ideal body weight, managing stress. Conclusion: coronary heart disease is a serious disease that can be fatal if not recognized early. However, by paying attention to early signs such as chest pain, fatigue, and shortness of breath, and consulting a doctor, you can detect and manage this disease better. If you or someone close to you experiences symptoms like the above, do not delay checking with a medical professional. Remember, early detection can save lives.